Patch USMLE style question. Persistent truncus arteriosus. A 2-day-old newborn is evaluated for cyanosis and respiratory distress. Physical examination reveals a harsh systolic murmur at the left sternal border and bounding peripheral pulses. Echocardiography shows a single arterial trunk overriding a large ventricular septal defect, VSD, supplying both the systemic and pulmonary circulations. Which of the following embryological structures failed to develop properly in this patient? Endocardial cushions of the atrioventricular canal, B. Aorticopulmonary septum, C. Septum primum, D. Muscular ventricular septum, E. Right vitaline vein. Answer B. Aorticopulmonary septum. Persistent truncus arteriosus is a congenital heart defect caused by failure of the aorticopulmonary septum to properly divide the truncus arteriosus into the aorta and pulmonary artery. This results in 1. A single arterial trunk supplying both systemic and pulmonary circulations. 2. A ventricular septal defect, VSD, since the aorticopulmonary septum also contributes to ventricular septation. 3. Excessive pulmonary blood flow leading to pulmonary hypertension and heart failure. Clinical features: cyanosis due to mixing of oxygenated and deoxygenated blood, bounding pulses due to increased pulse pressure from diastolic runoff, harsh systolic murmur from the associated VSD. Why the other answers are incorrect? A. Endocardial cushions of the atrioventricular canal. Defects here cause atrioventricular septal defects, AVSDs, seen in Down syndrome, not PTA. C. Septum primum involved in atrial septal defect, ASD formation, not truncus arteriosus. D. Muscular ventricular septum contributes to VSDs, but the primary defect in PTA is failure of truncal division. E. Right vitaline vein contributes to venous development, IVC portal system unrelated to PTA. Key takeaways. PTA is caused by failure of the aorticopulmonary septum to divide the truncus arteriosus. It presents with cyanosis, bounding pulses, and a VSD murmur. Surgical correction is required early in life to prevent irreversible pulmonary hypertension, Eisenmenger syndrome.